Have you ever found yourself awake at 3 a.m., staring at the ceiling, counting how many times you've gotten up to use the bathroom? Once, twice, maybe 3 or 4 times in a single night? That exhausting cycle that leaves you drained the next day? Well, I'm Dr. Neraya Wolfe, urologist and pelvic surgeon, and if you're facing questions or concerns about your urological health, especially those issues that feel too personal to discuss, stay with us. We're here to help you understand your body with clarity, compassion, and real solutions that work. You know, in all my years practicing urology, one thing has consistently troubled me. So many men suffer in silence with prostate issues, believing it's just part of getting older or something they have to accept. They don't talk to their partners, they don't talk to their doctors, they just endure it. And that breaks my heart because it doesn't have to be this way. Today, I'm going to share 5 simple lifestyle changes that can dramatically improve your prostate health. These aren't expensive supplements. You don't need a gym membership. You don't need surgery. These are everyday adjustments that carry extraordinary power. And the third one, most men think they need to give it up as they age. Actually, it's quite the opposite. Let's dive in. No fluff, just the science and the truth you need. Understanding your prostate. Why it matters more than you think. First, let's talk about what we're actually dealing with here. Your prostate is a small gland, roughly the size of a walnut, nestled just below your bladder. It wraps around your urethra, the tube that carries urine out of your body. When you're young, you probably don't even know it exists. But here's what happens as the years go by. Starting around age 50, the prostate begins to enlarge in most men. This is called benign prostatic hyperplasia, or BPH. It's not cancer, but it can seriously diminish your quality of life. According to data from the American Urological Association, more than half of men in their 50s show symptoms of prostate enlargement. By age 70, that number jumps to over 80%. Think about that. 4 out of 5 men. What does this feel like in real life? Your urinary stream becomes weaker. You feel like you can't fully empty your bladder. It takes longer to start urinating. And worst of all, you're waking up multiple times each night to go to the bathroom, what we call nocturia. Your sleep quality collapses. You're tired during the day. You're irritable. It affects your relationships, your work, your sense of well-being. Many men tell themselves, this is just what happens when you get older. Nothing I can do about it. That mindset is not only incorrect, it's dangerous. Because recent research shows us that prostate inflammation and enlargement can be prevented and even reversed through daily lifestyle choices. So let me walk you through the 5 habits that can change everything. Habit number 1, master the art of hydration timing. This isn't just about drinking more water. It's about drinking the right amount at the right time. As we age, our sense of thirst diminishes. You might not feel thirsty, but your body is already mildly dehydrated. When you're dehydrated, your urine becomes concentrated and acidic, filled with waste products that irritate your bladder and inflame prostate tissue. This creates a vicious cycle that worsens nighttime urination. A study published in the Journal of Urology followed over 2,000 men aged 60 and older. The men who drank adequate fluids throughout the morning and afternoon, but limited intake after early evening, experienced a 41% reduction in nighttime bathroom trips. 41%. That's nearly half. Here's my recommendation. Start your day with a full glass of water as soon as you wake up. Throughout the morning, drink 2 to 3 more glasses. After lunch and before 4 p.m., have another 2 to 3 glasses. Aim for 6 to 8 glasses total before late afternoon. Then, after dinner, minimize fluid intake. Avoid soups or watery foods in the evening. Just this one change can dramatically reduce how often you wake up at night. I've had patients tell me this single adjustment transformed their sleep and gave them their energy back. One more thing, caffeinated drinks like coffee or green tea have a diuretic effect, which can actually worsen dehydration. If you enjoy them, have them in the morning only. Skip them in the afternoon and evening. Habit number 2, take a 15-minute walk. After every meal, you don't need a gym, you don't need hiking boots. Just walk for 15 minutes after eating, especially after lunch and dinner. Why does this matter so much? Researchers at Seoul National University College of Medicine found that older men who took light post-meal walks had a 35% lower risk of developing prostate enlargement symptoms compared to those who remained sedentary. Let me explain the physiology. Walking increases blood flow to your pelvic region, delivering oxygen and nutrients to prostate tissue. It also helps regulate blood sugar after meals. Why is that important? Because diabetes and insulin resistance are directly linked to prostate inflammation and dysfunction. Walking also reduces systemic inflammation. markers like C-reactive protein and interleukin-6, substances that fuel chronic inflammation, decrease with regular movement. Since chronic inflammation damages prostate tissue, this effect is profoundly protective. Here's how to make it practical. After lunch, take a stroll around your office building or neighborhood. After dinner, walk around your apartment complex or through a nearby park. Keep it gentle and comfortable. You don't need to power walk or jog. 15 minutes is enough. If it's raining, walk the hallways of your building or through a shopping mall. The key is consistency. Instead of sitting in a coffee shop after lunch, take that time to walk. You can even bring your coffee with you. Habit number 3, maintain regular sexual activity. Yes, really. All right, this is where many men get uncomfortable. I understand. Even in my clinic, patients hesitate to bring this up. Some are embarrassed, others think it's inappropriate to discuss. But today, I'm going to say this clearly. Sexual activity is not something to abandon as you age. In fact, for prostate health, it's something you should actively maintain. In 2016, the European Urology Journal published findings from a Harvard study that followed over 30,000 men for 18 years. Men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated less frequently. Why? Biologically, ejaculation clears out accumulated waste, dead cells, and inflammatory compounds from the prostate. When these substances build up, they cause congestion, inflammation, and eventually more serious problems. Regular ejaculation is like a cleansing mechanism for your prostate. But the benefits go beyond that. Sexual activity improves pelvic blood circulation, relaxes muscles around the prostate, balances hormones, and lowers cortisol, your body's primary stress hormone. Chronic stress is a major driver of inflammation. For men without a partner, masturbation provides the same health benefits. This is not something to feel ashamed about. Medically, it's beneficial. It's part of taking care of your body. If you're experiencing erectile dysfunction or other sexual difficulties, please don't hide it. Come see a urologist. Modern treatments are remarkably effective. I've worked in this field for years, and I've seen so many men regain function and confidence after getting help. Gentlemen, aging does not mean giving up your sexuality. Not at all. Habit number 4, eat foods that actively protect your prostate. What you eat every day influences hormone regulation, inflammation levels, and even cancer risk. Food truly can be medicine, especially for prostate health. First, let's talk about lycopene, a powerful antioxidant found in red fruits and vegetables like tomatoes, watermelon, and guava. Tomatoes are the richest source. Here's the important part. You need to cook tomatoes to maximize lycopene absorption. Raw tomatoes are fine, but cooked tomatoes release far more lycopene, especially when prepared with a little olive oil. A meta-analysis published in the International Journal of Cancer found that men who ate cooked tomatoes twice a week or more had a 28% lower risk of prostate cancer. That's a significant reduction. Think tomato and egg stir fry, tomato-based pasta sauces, or tomato stews. Next is zinc, a mineral concentrated heavily in prostate tissue. Zinc is essential for testosterone balance and maintaining prostate structure. Foods rich in zinc include pumpkin seeds, oysters, and nuts. Pumpkin seeds are an easy snack. Munch on them while watching TV instead of chips. Then there are cruciferous vegetables, broccoli, cauliflower, cabbage, and kale. These contain a compound called sulforaphane, which supports detoxification and protects against DNA damage. And cellular mutations. This is critical for preventing prostate cancer. My dietary advice: build your meals around vegetables in a variety of colors. Choose lean proteins like fish and chicken. Eat whole grains. Use healthy fats like olive oil or paprika oil. Include antioxidant-rich fruits in moderation. Now, what should you avoid? Red meat in excess is problematic. Processed meats are even worse. Fried foods, high-sugar foods, and alcohol should be limited, especially alcohol. If you have prostate enlargement, you've probably noticed that drinking makes your symptoms worse. Habit number 5, prioritize quality sleep. Sleep isn't just rest. During sleep, your body performs critical maintenance. Hormones like melatonin and growth hormone are released, which reduce inflammation, repair tissue, and regulate immune function. A study in the journal Cancer Epidemiology found that men with sleep disorders had double the risk of aggressive prostate cancer compared to men with healthy sleep patterns. Double. Sleep affects testosterone levels, inflammation control, mental health, and metabolic balance, all of which influence prostate health directly or indirectly. To improve your sleep, go to bed and wake up at the same time every day, even on weekends. Keep your bedroom dark, cool, and quiet. Avoid caffeine in the evening, reduce screen time before bed, blue light from phones and TVs suppresses melatonin production. Aim for 7 to 9 hours of sleep. If nocturia is ruining your sleep, go back to habit number 1, adjusting your hydration timing. When nighttime urination decreases, your sleep quality improves, creating a positive cycle. Putting it all together, your 4-week action plan. Let me summarize the 5 habits. 1. Hydrate smartly. Drink 6 to 8 glasses of water before 4 p.m., then limit evening fluids. 2. Walk after meals, 15 minutes after lunch and dinner. 3. Maintain sexual activity, regularly with a partner or through self-care. 4. Eat prostate-protective foods, cooked tomatoes, pumpkin seeds, cruciferous vegetables. 5. Sleep consistently, 7 to 9 hours, same schedule daily. Each habit seems simple on its own, but together they create profound change. Here's a practical 4-week plan. Week 1, lay the foundation. Start adjusting your water intake. Drink 6 to 8 glasses before 4 p.m. Begin your 15-minute post-lunch walk. Track your sleep, what time you go to bed, how often you wake, what time you rise. Week 2, improve your diet. Eat cooked tomato dishes at least twice this week. Start snacking on pumpkin seeds. Add a 15-minute post-dinner walk. Week 3, go deeper. Have an honest conversation with your partner about sexual health. If that's difficult, consider consulting a urologist like me. Add a cruciferous vegetable to every meal. Establish a consistent bedtime routine. Week 4, reflect and adjust. Review the past 3 weeks. Are you waking up less at night? Is your urinary stream stronger? Are you sleeping better? Keep what's working. Adjust what isn't. And if you haven't had a health checkup in over a year, schedule a urology visit. Men over 50 should have prostate screening annually. A final word, your health is a choice, not a fate. Prostate health doesn't require expensive medications or invasive procedures. It requires consistency, intention, and small daily actions. I'm a doctor, but I'm also aging. I practice these 5 habits myself. My husband, in his 60s, does too. We've experienced the benefits firsthand. If this message resonates with you, please share it with the men in your life. Your father, husband, brother, friends. Men often don't talk about these issues, which is exactly why they need this information. Prostate problems are not inevitable. They're not a sentence you have to accept. They're a challenge you can meet with knowledge, action, and care. Your healthy future starts today. If you have questions, leave them in the comments. I'll respond personally. In my next video, I'll go even deeper into prostate-friendly and prostate-harmful foods. I'm Dr. Neraya Wolfe. Thank you for trusting me with your health. Take care of yourself, because you're absolutely worth it.